Welcome to Aging in Place Strategies and Answers with Linda Prio. Will it be possible to remain in my home as I age? Do I feel safe in my home? How do I figure out how much support I will need when my health needs start to change? What if I decide to move into a community instead? Which community will meet my needs now and in the future? Who will play a role in helping me with decision making? Do you ask yourself these same questions? Aging in Place Strategies and Answers can help you gain practical knowledge that will help you create your own Aging in Place roadmap. If you are already a care partner, a power of attorney, or in crisis mode with your Aging in Place strategy, you will learn what you need to know that you don't know. For over 20 years, I have been marketing Aging in Place services to clients and educating families and healthcare professionals in how to put aging in place strategies into place. When you utilize aging in place, you are allowed to choose where you want to live and make those decisions so that you can retain your quality of life. Thank you for joining me today on Aging in Place Strategies and Answers. Today, we are going to circle back and pick up a thread from a previous podcast in which I mentioned short-term rehab stays. In that podcast, we learned about skilled nursing and long-term care communities, and many long-term care communities offer short-term rehab stays. In this podcast, we will learn what a short-term rehab stay is and how to qualify for that benefit when it is prescribed by your physician. While we are on the subject of rehab stays, I am also going to introduce you to acute rehabilitation hospitals, outpatient day programs that provide intensive rehabilitation therapies, and review something that you probably already know about, outpatient therapy clinics. If you have been listening to my podcast, you learned that looking at the name of the community could help you discern what kind of community it is. Many skilled nursing communities offer short-term rehab stays, and you will see rehabilitation in the title of the community. In today's market, there are also a few standalone short-stay rehab communities popping up. When it comes to rehabilitation services, it is very important that you know and understand what kind of insurance you carry and its benefits. In Season 1, I talked about the information on your insurance card. The information on the front of the card will list the name of the insurance company you are insured by. Many carriers have multiple types of policies, so if your friend says, "I have a policy with such and such company, just like you, and my plan pays for that. I don't know why yours doesn't pay for it." Remember that even if you have the same insurance company, it doesn't mean that you and she have the same plan and the same coverage. So stop listening to your friend and know what you do have. On the front of your card, the plan, member, and group numbers are always at the top of the card, and the card has your name on it. The important information is on the right side of the card because it will list copays and benefits that come with that policy, but not everything. Most of the other information came with a policy booklet, so refer to that booklet if you need to learn more about the specifics of your policy. There's no need to be afraid of getting that booklet out and trying to read through it. Policy books are usually written in easy to understand language, usually that somebody with an 8th grade education can understand. But you can always go back to the person you bought it from and have them explain it to you, or to have them look up those particulars. Just make sure that you're getting good information. The back of the card has the important numbers to call when you have a claim or need help with benefit information. And one more tip. During the admission process, you will be asked for your current insurance card. Only carry your current card. Shred the other ones. During the admission process, I was asked for my medical card, which I gave them and they copied. And so I assumed that it was added to my hospital info and record. But I started getting bills stating that I had no insurance with a particular company. And on further examination, I realized that even though they had taken the information, had copied my cards, they failed to correct the record. And so therefore they were billing an insurance company that I was no longer insured with. So be aware that this can happen. When I began my career, traditional short-term rehab stays were the norm, not the exception. When patients had hip replacements or knee replacements, pneumonia, weakness from falls, stroke, cardiac rehab, UTIs, and other hospitalizations, many people went to a short-term rehab community for recovery. There were not other choices like there are today. In addition, it was found that more patients recovered faster and were less confused if they rehabbed in a familiar environment. But there have been many, many changes, including the kinds of insurance that is being offered today, who is the best patient that qualifies for a rehab stay, who will do the best in a rehab stay, and of course, Medicare has made many changes in guidelines. So, the goal of a short-term rehab stay, if you're offered it after a hospitalization, then you know that it is an essential type of medical treatment for those suffering from an injury or illness. Its primary purpose is to restore an individual's physical, mental, and or emotional capabilities to their optimum functioning level in a short period of time, usually 3 weeks, but in today's healthcare, it could be 10 to 14 days. Each Medicare Advantage plan has a case manager that is following you and your progress and will set the discharge date. Now, how do you qualify for a short-term rehab stay? Well, there must be a reason why a patient would need additional time to recover from the condition that sent them to the hospital. This could be a serious surgery, it could be illness or injury. You could need physician supervision and coordinated care with therapy. But you need to have been in the hospital for at least 3 days or 2 midnights, commonly known as the 3-day rule. Check your Medicare or Medicare Advantage policies for more information because traditional Medicare and Medicare Advantage plans are written differently. In addition, the 3-day inpatient stay in the hospital must have been medically necessary for an illness or injury as determined by your doctor. For Medicare to cover your stay in a skilled nursing facility once you're discharged from the hospital, your needs must include skilled nursing or rehabilitation services such as physical therapy, occupational therapy, or speech-language therapy. Medicare-covered inpatient rehabilitation includes not only the therapies, but a semi-private room, your meals, nursing services, prescription drugs, and other hospital services and supplies. Here is another factor that can determine whether or not you qualify for a short-term rehab stay. Were you admitted by the doctor into the hospital, or are you in the hospital under an observation status? What you need to know is that an inpatient stay in the hospital begins the day you are formally admitted as an inpatient to the hospital. Inpatient days are counted using the midnight to midnight method. A day begins at midnight and ends 24 hours later. The 3 consecutive day count does not include the time you might have spent in the emergency room, in outpatient services, under observation, or the day you are discharged from your inpatient stay. Now, a word from our sponsor.
Which would you rather spend per month, 4 to 6,000 and live in an assisted living community, or less than $60 a month and remain at home? The electronic caregiver is a safety device that can help you remain safe in your home in both medical and safety situations. Electronic caregiver can have many options that can be tailored to the needs of the individual, giving you peace of mind. Electronic caregiver is available nationwide. Let's talk. Cheryl Wilson, 314-283-0943.
Let's return to the podcast. It is important to know if you are in the hospital as an inpatient or as an outpatient under observation. If you are under observation, you may not need a short-term rehab stay, and you can use outpatient services instead. Observation means that you are not considered an inpatient. However, you may be under observation on a floor of the hospital that is also for patients who are there as inpatients. If you are under observation, the hospital must provide you with a notice called the Medicare Outpatient Observation Notice. This is important because if you have not spent a minimum of 3 days as an inpatient, you will not be eligible for traditional Medicare Part 8 benefits in a skilled nursing facility. So it's always good to check with your doctor, social worker, or case manager, or a hospital patient advocate to make sure of the status at the hospital. Key questions to ask are, is my hospital stay inpatient or observation? Does my insurance cover require a 3-day stay before receiving care at a skilled nursing facility? Now, I want you to know that this happened to me, and of course, I do know a few things from working with a variety of clients and family members over the years. And one particular time, my mother was in the emergency room, and the attending physician there in the emergency room said, well, we're going to put your mom in a room and keep her overnight. And I asked the doctor, is she going to be admitted or is she under observation? And he looked at me like, why would you want to know that? And I told him, I said, I know it seems like an odd question, but it really matters. And so I'm just asking you for insurance purposes. So he told me then that my mom was going to be admitted. So that was assuring. One big change that happened that took away short-term rehab stays was that orthopedic patients who were getting hip replacements and knee replacements, as well as cardiac patients, were put in a bundled payment system by Medicare. Medicare bundled the payment given to providers for orthopedic procedures as well as cardiac events. The service providers were in charge of managing how the money was going to be spent for that event. Underspending was better than overspending, and this is why fewer patients qualify now for a rehab stay, because it saved a lot of money in that bundle. Now, some patients have done really well going home straight after surgery at a surgery center. And there are others who have called our office saying, oh boy, my loved one is home now after a rehab surgery for their knee or their hip or perhaps a cardiac event, and I'm just not equipped to take care of them at home. What can you do for me? And so we are able to meet with the family and then to figure out how much care they're going to need. And yes, these services are available at your own expense. Patients are beginning to understand the system now, and so when they are scheduled for a rehab surgery like this, they are already making phone calls to see how much care they're going to need to be successful when they go home after surgery. They may live alone alone, or they may not have a lot of support at home. So they're inquiring about how much it will cost them to put extra care support in place. But this is the wave of the future. So when you're going through this yourself, be prepared and know what kinds of questions to ask. And that's what we do on this podcast. We learn and we ask, and then we know what to do next. Well, many hospitals have created what is called a joint business venture with acute rehab therapy companies. So the next time you go to your hospital, notice if they have an acute rehabilitation hospital on site, but perhaps on a different floor. Now, just like not all patients will qualify for a short-term rehab stay, not all patients will qualify for an acute rehab stay within a hospital or even a standalone acute rehab stay community. In addition, not all insurance products pay for an acute inpatient rehabilitation stay, but it is a wonderful opportunity for you to get the therapies that you need before you get home. This is how you can qualify for a hospital-based acute rehab stay. The patient's physician certifies that inpatient hospitalization for rehabilitation is medically necessary, and the patient requires a relatively intense, multidisciplinary rehabilitation program. That rehabilitation program is going to be provided by a coordinated, multidisciplinary team, and the goal is to upgrade the patient's ability to function as independently as possible. And the care that is provided in a Medicare certified facility, which has 24-hour-a-day availability of a physician. Now, this is usually for patients who can withstand at least 3 hours of therapy per day and who also need medical oversight. They can usually qualify for this form of therapy. It is usually for about 10 days to 2 weeks, and the goal is always to return home. Once returning home, the patient should be able to function independently and continue their outpatient rehab. If you are advocating on the behalf of your patient, if a short-term rehab stay is denied, then most likely they will not qualify for an inpatient acute rehab stay. But if they qualify for a short-term rehab stay, ask for this kind of therapy program and if their insurance will cover it. These programs are very successful for the right person, but it's not right for everyone, especially for those with a higher level of debility that could not handle the amount of therapy required. Now, I just want you to know that, again, I'm speaking from experience. And because my mother was aging and she was aging in place, there were times when certain things were denied. And so I had to keep asking questions about, well, if you're not going to send her for a rehab stay, could she qualify for an acute rehab stay in the hospital? Or if that's not appropriate, then is this appropriate? Just because your case manager or your resource person in the hospital is telling you, well, no, they don't qualify for this, it really behooves you to keep asking questions. And this is what this podcast is really all about. It is about putting you in the driver's seat when your loved one is not able to function at home successfully. Well, what is possible? What are we supposed to do? And in my mother's situation, this is my personal experience again. My mother had fallen. She had a broken pelvis. She was in a lot of pain. She was totally misdiagnosed. And she couldn't stand. She couldn't get in and out of bed. She couldn't walk. So what were we going to do now? Okay. Well, long story short, I kept asking questions, and after a day and a half of therapy, my mom, it was diagnosed that she had 2 blood clots in each leg in her calf. So going home really was not an option. So we figured it out together and we worked together. But if you don't know these things exist, you won't know what to ask for. And so this is why knowledge can be so important. So let's say that you're in the hospital and your loved one does not qualify for an acute hospital rehab stay. Well, there are standalone acute rehabilitation hospitals, so you might want to reach out to one of those. Here is another tip, that if you were offered a rehab stay, but you decided you didn't want to do that you felt like you were just fine and that you were going to go home and that you didn't want to go to the rehab community. But let's say that you are home and you're really not improving very well. In fact, you're really not able to get up and down easily or in and out of chair, and you also have a medical need going on. If it has been less than 30 days since your hospitalization, you could call a rehab community. You could call even an acute rehab community and see if you could be reassessed for a rehab stay. Now, bear in mind your insurance, your need for 2 kinds of therapies, in addition to a medical need that would need to be addressed, needs to be considered. But if you're approved, then you've gotten what you've needed in order to be successful after a qualifying event. Well, the next kind of therapy program I'm going to tell you about is an outpatient intensive day therapy program. Start noticing if your community has these day therapy programs. The key word is day programming, and it is perfect for those with the need for at least 2 kinds of therapy. These programs are a great solution when short-term rehab stays are denied or an acute rehabilitation stay is not covered. These programs began about 12 to 15 years ago, but it took a while for them to really catch on strong, but they are here to stay. These programs help build physical strength and functional skills so that individuals can manage activities of daily living as independently as possible. Treatment plans are created so individuals can enjoy their favorite activities, participate in family or social get-togethers, and return to work. So, they're not just for seniors, but a lot of seniors use them. Now, who can benefit? A person can benefit from day therapy if they're recovering from a stroke or have another neurological event. Perhaps they're recovering from a traumatic accident or have had an extended complex medical stay. Perhaps recovering from an amputation, or they live with Parkinson's disease, multiple sclerosis, Guillain-Barré syndrome, but they have had a decline in function and are struggling to live on their own. Therapists will work with you and your referring physician. Yes, you will need a physician order to personalize your treatment plan based on your unique situation and goals. Sessions can include a combination of physical, occupational, speech, and recreational therapy. Activities of daily living like cooking and laundry are practiced in functional settings to ensure you are comfortable in your home or wherever you might go. Therapists may also recommend and instruct you on how to use adaptive equipment to enhance your abilities and maximize your safety. Sessions can last up to 4 to 5 hours a day and are offered several days a week. Transportation services might also be available, or they might charge a small fee. In addition, if a person goes through the program, then starts to fail at home again, and needs this intense therapy to get back to prior functioning or to a better level of functioning, then the therapy team can evaluate and get doctor's orders for the patient to start the program over again. A program that allows you to engage in intensive rehab during the day, socializing and seeing others work to improve their functionality while recuperating in a familiar environment is priceless. And I have to tell you, I'm a huge fan. Now, many of you have seen outpatient therapy clinics in shopping centers or near your hospitals or in medical plazas. For seniors with traditional Medicare, outpatient programs bill under Part B, not Part A. Seniors with Medicare Advantage plans should check their cards to see what benefit is available when outpatient therapy is prescribed. Outpatient therapy clinics treat all age groups, and they will tell you what is covered based on your insurance plan. These types of therapy programs are in every neighborhood, but they do not provide transportation. And physical therapy, occupational therapy, and speech therapy is most often done 2 or 3 times a week for at least maybe 4 weeks. Advanced cases that require a longer time for rehabilitation, primarily following a surgery, may require physical therapy for as long as 3 to 6 months. But this kind of program always entails performing therapeutic exercises that help strengthen weak muscles and stretch muscles that are too tight in order to restore balance, improve posture, increase functional strength, range of motion, and to decrease pain. The length of treatment ordered will definitely depend on your insurance and your improvement. No matter what kind of therapy program provides treatment, it is your responsibility to do your therapy exercises in order to achieve recovery. If you begin a therapy program but are not committed to seeing it through and do not practice the exercise plan created for you, well then, you will probably have a limited therapy experience. Last season, you and I talked about medical home health for a patient that has been discharged home from hospital or skilled rehab short stay program. Remember that that is a physician-ordered program, and it bills under Medicare and Medicare Advantage plans for homebound patients. Being unable to drive doesn't make you homebound, but perhaps your current health prevents you from being able to seek therapy at an outpatient clinic, and so therapies will be provided at home on a limited basis. Today's discussion has been an intent to help you to understand changes that have occurred during Medicare, the necessity of you really understanding and knowing your insurance, and to learn about other kinds of therapy programs so that you can choose what might work best for you. At the end of the day, your ability to participate in therapy, to learn the exercises and do the exercises are going to be the key indicators on how much you will actually improve. As always, at the end of every podcast, I offer a caregiver tip. Now, let's say that you have a loved one or a family member in a hospital, and the case manager comes to you and tells you that the hospital stay is ending and they are going to be discharged on X date. What now? Well, there's a lot of questions that you need to be asking on what is next for my patient, and can you walk me through this, and what is being recommended by the physician so that I know how to proceed. When the case manager comes and tells you that you're going to be discharged on X date, it's going to happen. And so a lot of people call our office and say, I was never notified. And, we have to take that, what they're saying, but generally you are notified. And it's important that you realize that there's not much going to change either way, because your insurance is really going to determine that discharge date as well as the attending physician. Now, you need to realize that people are leaving the hospital quicker and going home sicker. So being prepared is better than not being prepared. But I also want you to know that the same thing will happen if you have a loved one who is in a short-term acute rehab, or who is actually doing a rehab stay. They are probably going to arrive at the rehab community weaker. And of course, they're not going to get a lot of time, because that's just the way of the world. So I want you to be prepared when people are going to be discharged home. So let's say that this is our scenario, that your loved one is at a rehab community. They've been rehabbing, and they say the insurance and case management team is telling us that your loved one will most likely be discharged in 3 days or 2 days or a week. It's important that you put your listening ears on and ask, do we know what to expect at that time? What are the assessments telling us? Because you have the opportunity at that rehab center to visit with the team and to really get a good idea of what your loved one can do and what they can't do. But here's what I also want you to know. Only in a long-term care community that also has a rehabilitation portion will allow you to continue to stay, but pay privately. And sometimes, in many cases, this can make a huge difference in the skill level of the person who's coming home. We recommend that quite often. We had a patient whose family had called us. We had met several times over the phone, and I told them, I said, I really feel that your loved one is at the highest level of care now. If you can private pay for them to stay in the community a little longer and continue to have therapy where they are improving, it will probably be in their best interest. And so they did that, and that's exactly what happened. And when the person came home, they were so much easier to take care of. So I just want you to know that you need to be listening, you need to be asking questions, and when you don't understand something, it's okay to ask additional questions. Exercise, nutrition, and medication adherence are important to recover. So when your loved one comes home, develop a daily regimen of therapy exercises and walking. Standing exercises when the patient is at their best, and sitting exercises when they have eaten and taken their medications are most alert. Caregivers, thank you for all you do. Thank you for joining me today. Please remember that this podcast is intended as guidance and not advice. Share this podcast with friends and family who are currently in crisis mode, or with people who would like to start developing their own roadmap for aging in place. Listeners, if you would like a deeper dive into a topic discussed during a podcast, please subscribe to Aging in Place Strategies and Answers, where you will be able to access premium content. Or if you would like to suggest a topic for this podcast, please contact me at linda.agingstrategies@gmail.com. As always, I value the time you spend with me.